देश विदेश की खबरों को जानने के लिए हमारे चैनल को सब्सक्राइब कीजिए और बेल आइकन को क्लिक कीजिए।
Corona has created a lot of angst, a lot of fear in the hearts of our people. And huge part of this is because there is not enough information about what the disease can do, how it spreads, and its overall impact. Today I'm speaking to two world-class healthcare experts, Dr. Ashish Jha from Harvard University and Professor Giesecke from Sweden. They have divergent views, so let's take a listen. Professor Jha, lovely to see you. Welcome. I'm looking forward to having a conversation with you.
Rahul, thank you so much for having me on.
How are you doing today?
Oh, I'm great. Thank you very much for joining me, and I'm looking forward to our conversation.
What is your view on the idea of a lockdown, and how does one pull oneself out of a lockdown? Because it is, what I'm realizing now and what a lot of people are saying is it is a psychological change. When you classify the disease and then you say we're going to have a lockdown, you change the psychology of the people, the psychology of the population, who now suddenly are convinced that this is a very dangerous thing, which it might be. But you then have to wean them off that idea, and you have to do it carefully. You can't just blow open the doors. So how does one navigate this complicated space?
Yeah. So there are two aspects of it that are both worth talking about, both the sort of pure public health aspect of why do the lockdown and how to release it, and then the psychological aspect that you have described. And they are very interrelated in a way that I think policy people have not always understood. So let's start with the public health part of this. You know, the reason to do a lockdown is you're trying to slow down the spread of the virus, right? So the virus is a new virus. The humanity has not seen this virus before. And that means all of us are susceptible, right? We have a very susceptible population. And left unchecked, the virus is going to grow exponentially. We think on average, the virus infects 3 more people. And so, 3 becomes 9, 27, 81, and all of a sudden you've got exponential growth, millions of people. And the way to stop it is to take infected people and separate them from uninfected people. Mm-hmm. Well, how do you do that? You have 2 choices. You can do really vigorous testing and tracing and isolation. But if you can't do that, then you have to lock everything down. So can you slow the virus down from a lockdown? Of course you can. But of course it has very substantial economic repercussions, most of which there are many people who have much more expertise than I do on the economic issues. But it clearly has them. The other thing is, I always ask about the lockdown is, what are you using that time to do? How do you prepare for releasing the lockdown, right? Because lockdown buys you time, but lockdown is not the goal unto itself. So you want to use that time to prepare a really fabulous testing, tracing, isolation infrastructure. You want to use that time to communicate to people, and now we're going to get into the psychological issues, that life will be very different when lockdown ends, that this is not about going back to what life was like last May or June, that the life over the next 6, 12, 18 months is going to look very different. And it's really about planning all of that out. So it's not just communication, but really thinking through, what will public transportation look like? Who will go back to work? What will schools do? There's a lot of work that you want to be doing during the lockdown. And the last point I'll make on this is around the psychological issues. There is a very clear signal you send to people when you lock down. We have had lots of disease outbreaks in India and elsewhere. We've never had to do a national lockdown. Yeah. So you're saying to people, this is different. This is much more serious and is potentially much more devastating if we don't do this. And so now you have, when you open up the economy, you have to create a certain level of confidence, because the economy resides on confidence. And if people are scared, they will not engage in economic activity. So you have to create some amount of confidence back. It's a complicated thing. I haven't seen any country in the world do it brilliantly, but everybody is kind of making their way through these things.
I was speaking to some migrant laborers who are making this journey home. And I've spoken to quite a few of them. And a lot of them say that the really frightening thing for them is the uncertainty. They don't know. They live on minimum wage. They live on a daily wage, and they say, look, we don't know what is going to happen tomorrow. And that's the real problem for us. So how does one think about opening this lockdown in a way, medically, so that you minimize this type of uncertainty, so you don't have an accident with a second lockdown? What are the type of things medically you need to think about?
So first thing, I think it's really important, and I've been saying this here, and I think it's really important for everybody to communicate, is that this is a 12 to 18 month problem. We are, no matter what we do, we're not going to be out of the woods. We're not going to be through this problem by July or by November. This is going to be with us till 2021. And if everything goes very, very well and we have a vaccine and it's widely available, then sometime in 2021, life can begin to go back to normal. The reason it's important to communicate that is people need to understand the time frame and need to understand that lives are going to change over that time. Obviously, for people who are very poor, who are hourly wage workers, daily wage workers, the uncertainty is very, very costly. And so this is why it's extremely important to have a strategy. So as you open up, you can create confidence in people that you're not going to have a massive outbreak. And there's a set of policies you can take to reduce that. Now, to be perfectly honest, no one can guarantee that we will not have major outbreaks. Another lockdown won't be, but you can minimize that risk. And that is the key thing that I've been encouraging political leaders, policymakers around the world to do, is implement all of those things so you minimize the chances as you come out of lockdown that you'll have to shut down again.
What about the strategy of testing? I mean, yes, you have to test quite a lot.
Yeah.
But is there a particular method to testing? Are there certain areas that we test? How do we think about testing as a strategy?
Yeah. So people, by the way, there's nobody, I would say, well, actually, I shouldn't say nobody. South Korea, Taiwan, Hong Kong, the East Asian countries have actually done a very, very good job of this. But certainly in Western Europe, United States, people are still trying to come up with what is the right testing strategy. My general approach on this has been, you have to have, so let's kind of talk in generic terms and then maybe customize it a little bit for India. So in generic terms, you should be testing anybody with any kind of symptoms. You won't pick up everyone because there are a lot of people without symptoms. We think, probably 20% of people have no symptoms throughout their entire disease, and another 20-25% of people spread the virus before they develop symptoms, but they will eventually develop symptoms. So you should be testing everybody with symptoms. And then you should have a strategy for surveillance of high-risk areas. And so you have to sort of think about what are high-risk areas, and that's where you really have to customize it. To individual things. So, we talk at least here a lot about homes for elderly people or hospitals. My feeling is anybody who gets admitted to a hospital for almost any reason in an area with any kind of an outbreak should be getting tested. Mostly because if you miss an asymptomatic person, let's say who comes in with a heart attack, or let's say comes in with a broken leg, but they're asymptomatic and spreading, they could spread it to 30 healthcare workers and 70 patients, and that would be a disaster, right? So you need a very aggressive testing strategy in high-risk areas like hospitals, like homes for elderly people, et cetera. And then, if you can, you want to be doing more community-level surveillance just to make sure that you're not missing undetected disease. So it's really a combination of all of that, and it depends on how much testing capacity you have.
India's got a unique aspect to it, which I don't know if the United States and other countries have, which is that we've got a large young population that is diabetic, that has heart disease, that has hypertension. Then we have a lot of poor people who work in polluted areas, they have lung disease. So we have this cohort of people, young people, who are also very vulnerable.
We know that the biggest risk factor for having a bad outcome from getting very sick or dying is age. And that is one advantage that India has, that it is certainly compared to Western Europe, to America, to many other places, or even East Asia. India is a younger population, so that's good. One is we are finding more and more that even healthy young people, some percent of them end up getting very sick from this disease. And so we should not be too cavalier, even for otherwise what looks like healthy young people. Then if you get into your issue of people who have lung disease, who have heart disease, who have diabetes, high blood pressure, those people are really at increased risk. Maybe not quite as much as a 75-year-old or 80-year-old, but definitely at much higher risk. And a lot of those people end up getting very sick and dying. So we really have to, in my mind, try to protect all of those individuals, which of course ends up being quite a lot of people. And so this is why, there's some people who say, well, maybe in places like India, we just let herd immunity happen and let hundreds of millions of people get infected. I think that's a terrible idea. And the reason it's a terrible idea is it will lead to millions and millions of people dying, and including a lot of young people with these conditions. So we have to take a strategy that tries to protect everybody, but particularly older people and younger people with chronic disease.
So you don't agree with some of these arguments, which I find very, very doubtful, that the virus doesn't operate in hot temperature. Indians are immune to the virus. We have certain vaccinations that protect us from the virus. I mean, I'm skeptical about this stuff. What is your view on that?
Yeah. So let's talk about each of them individually. So on the issue of Indians and vaccinations, I got a BCG vaccine when I was a child, and many Indians have. And there is some circumstantial evidence that maybe BCG vaccines can be helpful in reducing severity of the disease. It is not very good evidence. It is not evidence I would bank on. I certainly wouldn't make policy based on that evidence. And look, it's a new virus. There's new testing, new studies going on. And in the next couple of months, we will know much more, because there are some nice randomized trials that are happening now. So I suspect in the next 3 months, we'll know much more about whether these vaccines will play a major role. I am personally skeptical that the BCG vaccine will end up being an important mediator, but I don't know. We'll know. We'll know soon. But certainly, there's not enough evidence to make policy on that. On the issue of hot weather and temperature, so there is some evidence, again, that weather makes a difference. And we think that being outside, there's less transmission than being inside. So the home with 15 people all staying in one small home, small room, there's going to be very easy transmission. But once people are outside and there's air and all of that, that'll make it a little bit better. But the question that I ask people who bring up the temperature issue is, do we think it's enough that it will keep the virus under control? And I think the answer, no one I know thinks it's enough. So maybe instead of the average person transmitting it to 3 people, it'll be 2.5. Maybe it's a 20% benefit. Good, I'll take it. It's not going to be enough to get us out of this.
And you said something very interesting, which is relevant for India, which is that you're saying that a joint family system with old people living inside it is actually a complexity and a risk.
Absolutely. Absolutely. And we have seen this, coming out of places like New York, where a lot of the people who got sick and died in New York were older people who weren't going out and working. But basically what we think is that the young people they were living with were going out and working, coming home, and then there was interfamily transmission. So it's a very big challenge when that happens. And in India, of course, 3 generations living together is a very, very common way of doing things. So there is a real challenge of how do you protect older people, especially as you open up and people start going back to work.
Testing would solve the problem, because if
it would help a lot.
It would help, because if you could test at scale, you could test everybody, then you're much safer.
Yeah, and and obviously testing everybody, or depending on how big a population, is difficult. There are strategies that you can use to augment and do, there's pool testing. There's all sorts of things you can do to test large numbers of people with more limited kits. I've also felt that, India has many advantages. And one of them is a very, very advanced, very vibrant, technology and biotechnology industry. with a lot of people with a lot of capacity and capability. And so, when people have brought up testing and India's testing capacity, my sense is, what I say is, look, I'm not an expert on the exact specifics of which company in India can do what, but everything I know about India and everything I know about testing, on which I do know something, makes me think I am not convinced that India could not do much more testing than it does right now. I don't know why it couldn't. So, India's obviously been moving forward. They've been doing 80, 100,000 tests a day now. That's good. That's real progress from where things were. But I don't know what prevents us from being able to do many times that. And if we can get up to that level of capacity, then yes, we can test migrant workers before they get on trains.
I've asked some bureaucrats why sort of lower testing numbers, and their point is that if you push the testing numbers too high, you frighten the people much more, and you build up a much more frightening narrative. So that is, unofficially, that's sort of what they say. I think it's much more important to fight the disease and, push as hard as you can on the testing. But
one of the questions I've been thinking a lot about is, how will this virus change society? What will social norms and interactions look like in India 2 years from now? How do you think life will feel different? I've been thinking a lot about this, and I just am curious what your feelings are on that.
I don't think there will be one response to this disease. Every state will have its own response. You can already see that some states are doing much better than other states because of their nature, because of their design, because of their political system. I get the sense that the more decentralized states, the states that spread more power closer to the people, will do better. That's my sense. I think the large urban centers will get hurt badly. I hope that this disease will bring people together and bring them to the realization that you can't fight this disease as different religions or different communities or different genders or different castes. I think in some ways there is a potential opportunity here. There is an opportunity that in fighting this disease, we are able to start a conversation. We are able to understand that everybody is required to fight this disease, and we are able to work together to get out of this. I think there is a potential for that.
Yep.
I think we will also have to prepare ourselves for significant pain. I do worry about our older people, and I worry also about our younger people who are sort of critical for the future growth of this country. At the global level, I think the virus is operating at two levels. One, it's operating at a healthcare level. And two, it's actually attacking the globalized structure.
Absolutely.
So if you look at it's very interesting. If you look at the places that are vulnerable, they're all nerve centers of globalization. So I'm convinced that you're going to have a new world after this virus. And I also think that, for example, I think it's going to reshape Europe. I think the balance of power between the United States and China is going to change. So I think it is, as you said, we are entering, people say 9/11 was a new chapter. I mean, this is a new book.
Yes, I agree with that. Life will not look in any way, 5 years from now, will look nothing like what it did 5 years ago. Yeah. And it's not only hard to predict, but it is not faded, meaning we have a lot of influence over what life will look like in 5 years. And certainly a lot of the traditional models in our head of who are who's sort of the advanced economies and who's not. It's been very interesting for me being in the United States and saying, the countries that have responded the best are South Korea, Taiwan, Hong Kong, and the countries that have responded the worst are Italy, Spain, United States, and the UK. Welcome to the New World Order, right? This is not how we had always envisioned envision things. And so it will have long-term repercussions. I'm not totally sure I know what all of them are, but they will happen.
ये भैया बताइए वैक्सीन कब आएगी?
दो तीन तो वैक्सीन है जिसमें प्रॉमिस है. एक तो अमेरिकन वैक्सीन है, एक तो चाइनीज वैक्सीन है, ऑक्सफोर्ड का एक तो वैक्सीन है. तीनों प्रॉमिसिंग लग रहा है. I don't know which one will work. हो सकता है कि all of them, हो सकता है एक निकल जाए. I don't know. लेकिन I'm very confident कि वैक्सीन कहीं ना कहीं से next year तक आ जाएगा और work करेगा. And then India has to have a plan. क्योंकि इंडिया के लिए कितना 50 करोड़ वैक्सीन, 60 करोड़ वैक्सीन जरूरत पड़ेगा. And so India has to have a plan for how do you have that much vaccination available once it becomes possible. So that's an area where has to be a lot of focus. The other thing I will say, Rahul, that I think is very important is we are entering an age of pandemics. I am confident that this is not the last large global pandemic you and I are going to see in the next 20 years.
Why do you say we're entering an age of pandemics? What is the structural reason?
Yeah, so many things have happened that have made this. So we got lucky that in the 2009 H1N1 swine flu that ended up being not so bad, even though it was a global pandemic. So what's different now than, let's say, 20 years ago? You've actually touched on several of these. Globalization, right? And so a virus that gets started somewhere spreads globally very quickly. Second is the big environmental changes. All of this economic growth that China and India and many other places have had, which has been wonderful for lifting people out of poverty, has also meant encroachment into deforestation, encroachment into areas where there were more animals. And most pandemics, most disease outbreaks in humans, new ones, are jumps from animals to humans, right? So this virus has existed in bats, but there was a small change probably in the genome, and then all of a sudden it became suitable for human hosts. So I think climate change is going to make many of these things all much worse. And then, of course, the other thing that has happened with economic growth is people are eating a lot more meat. And so that also means more interactions between humans and animals. Put all of it together. If you look at the last 100 years, you can see increasing frequency of these kinds of outbreaks. And this one, of course, is the worst in 100 years. But I am confident that we're going to have more global pandemics in the upcoming years and decades. And so as we get through this one, we have to ask ourselves, how are we going to better prepare for the next one?
Thank you. Lovely chatting to you.
Be well, stay safe.
Good afternoon, Professor.
Good afternoon.
Thank you very much for agreeing to talk to me. I know you are extremely busy.
No problem. I have time.
I saw an interview of yours where you were suggesting some different ideas, and that sort of aroused my curiosity. You've been an infectious disease expert. How are you seeing this from Sweden and from Europe?
This is a disease that's spreading across the globe like a wildfire, and almost everyone in the world will be infected. But it's a very mild disease. 99% of the people who are infected will have very little symptoms or no symptoms at all. So what we're seeing now is 1% of the epidemic. The real epidemic is going on. We don't notice it really.
And now that we're in a lockdown, how do you transition out of the lockdown? What is the best strategy to come out of a lockdown? Because now it's a psychological reality, the lockdown, and an actual reality. So how do you come out of that? What is the gentlest way, the smartest way from a healthcare perspective to come out of that?
And that's a very good question. And I've been asking myself, all the countries in Europe that instituted a lockdown a month ago, 2 months ago, did they ever think about the exit strategy at that time? I don't think any single country said, we'll do this lockdown, we close the schools, we close the borders, we close the restaurants. I don't think at that point they thought about how do you get out of it?
Yeah.
And now everyone is asking the same question: how do we get out of this? It has to be stepwise, I think. That you take, of the restrictions you have in India, you take one away, you soften one restriction, you wait 2-3 weeks and see what happens. Do we have more spread of the disease? Yes, we had more spread. Okay, then we take one step back, reinstitute and try another restriction if that works. So I think it will take months to really ease out of all the lockdown, but you must do it one restriction at a time and see what happens.
And what is the role of testing in all this? How should one think about and use testing?
One is clinical. Of course, in the hospital, you want to know if a patient has the infection or not, of course. But then you can follow the epidemic a bit more across the country, see if there are special geography or special people that have it. So that's for planning a little. Then we have the new tests that you're aware of. We have the old test, the PCR test, which shows that you're infected right now, that you have the disease right now. And then there's a new serology test that show if you had the disease. And that will be useful also to see who had the disease and who is now immune, probably.
And of course, the real impact and the balance here is one between economic damage and the healthcare damage. So
yes.
How do you think about those two aspects of this?
I think the way we have done it in Sweden is, we said, the main thing is to protect the old and the frail. They should be protected from the disease. Everything else comes second. So what we have done, we haven't completely shut down the country. Many workplaces are still open. Many people are working from home if they can. We don't have restrictions. You can go outside and meet other people outside better than in your home. Well, that's part of the answer anyway. But at some point, and I think for India, I don't know India. I've been in Delhi once at your communicable disease center in Delhi, but it's many years ago. I think you will soon create more harm than good with a severe lockdown. That's my guess.
And that's from an economic perspective.
Economic and humanitarian, yes.
And of course, there is a connection between the economic side and the healthcare side, because while you're doing this lockdown, you've got sort of your hospitals sort of under COVID watch, so to speak. In India, they've sort of decided that they're going to maintain some space in those hospitals just for COVID. So a lot of patients who have other diseases can't actually access those hospitals.
I think for India, you'd ruin your economy very quickly if you had a severe lockdown. I think it's better skip the lockdown, take care of the old and the frail people, and let the other people have the infection. Most people will not even be sick. They will not even notice they have it. It's a mild disease. How are you talking about this balance between disease and economy?
I think the full lockdown is damaging, and the damage increases exponentially. So the sooner you get out of the lockdown, the better it is.
I mean, you may even create more deaths by a severe lockdown than the disease will do.
Exactly. The issue in India, of course, is that we have a central government and then we have large number of state governments. Yeah. And there is a tension between these two. The central government has one view, the state governments have another view. So a lot of that slows down the sort of the discussion. The big issue in India so far has been the migrant labor. The fact that we have large numbers of people living in slums who happen to be migrant laborers. And when they've done the shutdown, they actually can't go back to their homes in the rural area. So that has created a lot of concern. Food is going to become a serious problem because we have a lot of manual laborers who depend on daily wages, and they're already in trouble because they simply are not getting those wages. And so provision of food for them at scale is a challenge that the Indian government and state governments are facing.
Yeah. No, I think for you in the situation that India is and with the federal states and everything, I think you should have a very soft lockdown, as soft as possible.
Well, Anyway, I don't want to keep you. This was
No.
useful for
Can
me.
I take a picture of you on my computer?
Of course, you can take a picture of me on your computer. When are you coming to see us?
When do you want me?
Whenever you want. You said you only come once?
I only came once, and that's 20 years ago now.
Okay. Thank you very much.
Okay, thank you very much.